Hi everyone, welcome to another episode of the BDI vlog series. We've done a couple of blogs and vlogs on this already, but we just wanted to go into a bit more detail about the types of evidence that you can give the GMC to prove your English language skills. Generally speaking, there are three main routes. The first one is the OET, second is the IELTS, and then there are a couple of exemption routes that we're going to talk about as well. Okay, so first up we have the IELTS test. The IELTS test has been recognised by the GMC for a number of years now, and is probably the most commonly used or commonly known test that you can use for your GMC registration. What you need to do is to sit the IELTS examination, which is the International English Language Testing System, and you need to have at least a 7 in each of the 4 modules. The 4 modules being, of course, reading, writing, speaking and listening. You have to have achieved an average overall score though of 7.5, and all of the results have to be at the kind of required levels, but from one sitting. So you couldn't do one test and have a 6 in one area and then pass it with a 7 in the other area in the next one and fail the other areas. You need to have it all in one go. If you are using your IELTS test for PLAB 1, you need to log into your GMC account, go to the My Test section, and then it will validate your account, which can take a couple of days, so it's worth getting on there early if you are trying to book one of the PLAB slots, especially right now because we're aware there are some delays. It's quite popular and highly demanded service at the moment. So generally speaking, it's going to talk about lots of different types of English language. It's not specific to one topic. You could be listening to shopping lists or answering questions about English history. It could be absolutely anything. So it's very broad. It isn't just used for doctors. It is worth noting though that if you are going to use it for your GMC registration, you must sit the academic version. So when you book it, make sure it's an academic IELTS test. Yeah, good luck with it. Okay, so more recently than the IELTS test, the OET test has been recognised for registration with the GMC as well. Now, the OET is the occupational English test, and that kind of gives you a clue as to the main difference between that and the IELTS examination. Now, what we were just saying about the IELTS examination being quite broad, quite general, you could be talking about, like I say, shopping lists or something like that. Because the OET is based on occupation, it's going to be based on medicine. So you're going to want to book the medicine version of the OET examination. Now, you might find that that is not necessarily easier, but maybe more comfortable for you if, for example, you're working, I don't know, say for example you're working in the Middle East and you're working at a kind of an international hospital where English is the main language that you communicate with other clinicians and occasionally with patients. You might feel more comfortable doing the examination using kind of words, phrases, referrals from other clinicians, patient notes, talking about those types of things rather than kind of a more broad general English. The other main difference is that it's marked using kind of letters, so A, B, C formats, rather than the IELTS examination, which is obviously done on numbers. So you needed that 7.5, 7 in each module, 0 to 9 is the rankings. In the OET, we're talking about A's, B's and C's. Now, you'll need to get an average overall mark of a B, and that's a B in each of the 4 areas. Again, that's reading, writing, speaking and listening, and they need to be done in the same examination also. So once you've got your full report and your test results back, I think that takes 4 weeks with the OET as opposed to 2 weeks with the IELTS examination. You can use that to apply for your GMC as well. Okay, so in addition to the IELTS and the OET, and those are obviously the main routes and the routes that the GMC will push people to go down as the kind of main points of entry for their licence registration, there are a couple of exceptions. Now, you can in some circumstances use your primary medical qualification as evidence of your English language. It's quite strict. There's a list of organisations that are approved by that. You have to have completed it within the last 2 years. So it's not going to apply to more senior doctors. It will only be for very, very junior doctors. The other thing is that 75% of the course has to be sort of clinical, including kind of patient engagement. So, I mean, really, for us, we don't see many people coming through the route to GMC registration that have used that as their evidence, but it is there if you need it. More common that we would see, certainly, especially for doctors who are working overseas and trying to get to the UK, would be using an English reference form, which you can find on the GMC website and we'll link to basically get references from where you're working now, provided you're working in a country where English is the native language or one of the native languages. So if, for example, you're working in Ireland and you've been there for 2 years, and that's the important number, is that you have to have been practicing for at least 2 years consistently in that place. You could get references from a clinical director or a lead consultant or a supervising clinician, and they will be able to write about your competencies in, again, each of the 4 areas, and they can write about how you interact with patients, notes that you might be writing, referrals from GPs, etc., etc. Examples of those kind of countries, like I say, Ireland, America, Canada, Australia, Singapore is included on that list as well. Lots of the Caribbean islands as well, where English is recognised as one of the primary languages. So really, really worth, if you have been working in one of those places, or you are living there now, or maybe you were born there, checking whether or not those countries are on the list, because you might find that rather than sitting one of the examinations, the IELTS or the OET, you can get references from your current employer that will help the GMC make an adequate assessment of your English language. Alright, so hopefully that's been helpful. You can see a bit more information about the kind of main routes that we see and that we would encourage you to pursue if you're looking to get a license in the UK. One last thing is that obviously we do get a lot of people saying, you know, the benchmark is really high and the tests are really hard. Obviously that's set by the GMC, it's a licensing issue, and obviously we understand that the reason for that is because you want to be safe and working in a safe environment for your patients and for yourself. So I appreciate that some of the tests can be quite difficult, but the reasons that the language expectation is so high for international doctors only comes down to patient safety and just making sure that you're working in a really safe environment for yourself and others. Other thing I would say, just lastly before we go, we haven't mentioned the SELR, which is the Structured English Language Reference. The reason for that is that it's not very common, we find, with our NHS clients and partners that we work with. But if you'd like to know more about all of the different routes, we're going to link to the blogs and vlogs that we've done previously. And of course, you can get in touch and ask us any questions that you have about the English language requirements. So thank you very much for watching, and we will see you next time.